From her life as a model to the First Lady of the United States, Melania Trump is no stranger to the spotlight and to the public scrutiny that comes with it. But has the former First Lady ever had plastic surgery, or are her model-esque features all natural? Today, we'll be exploring Melania Trump's facial transformation. Estimated costs of potential procedures are provided at the end of the video, so make sure to stick around. In 1987, at the age of 17, what we see here is that Melania Trump has full eyebrows and her eyes are more almond-shaped. When we look at her nose, we can see that the tip has some natural bulbosity. And she has a balanced upper lip to lower lip ratio, and her lower lip appears fuller than her upper lip. She also has strong facial bony structure, so both her maxilla, or where the cheekbones are, and her mandible, where the chin and the rest of the jawbone is, are both quite prominent. In 1998, at the age of 28, what we see here is that Melania's upper horizontal third is longer than her mid-face and her lower face, and she also has a widow's peak at the hairline. You can see that she's sporting thinner eyebrows now, and this was the look of the 90s. I'm also seeing that her nasal tip to me looks less bulbous, and the dorsal hump, this area right at the top of the bridge, is less prominent. So I suspect that she may have had a possible rhinoplasty sometime between the age of 17 and 28. With rhinoplasty surgery, oftentimes the bridge of the nose is narrowed and the hump is removed, and the tip is made to be smaller. Both can be adjusted with a cosmetic rhinoplasty, and sometimes cosmetic rhinoplasties are done alongside a more functional rhinoplasty, where attempts are made to improve someone's nasal breathing as well. In 1999, at the age of 29, I wanted to point out here that Melania's left side of her face appears to be higher than the right side. When we look at her eyebrows, the level of the orbit, the nasal ala, and the oral commissure, they're all slightly higher on the left side compared to the right. And we all have this type of facial asymmetry. It's very, very common. I also see signs of potential lip filler that have been placed into her upper and lower lips. To me, they appear fuller. And around this time in 1999, this was before HA filler was actually FDA approved. The first FDA approved filler for the face was Restylane in 2003. So what was more popular to inject around this time was collagen and microdroplet silicone. In the year 2000, at the age of 30, we see some of the signs of her past possible rhinoplasty. We see more nostril show on frontal view, which is a very common feature after a rhinoplasty. When the nose is secured and the tip is slightly elevated, usually what happens is that the nostrils become more visible, both from a frontal view as well as a profile view. And along the bridge of her nose, you can see where osteotomies were likely done. And those are the bony cuts that are made to try to narrow the bridge of the nose. Also, when you reduce the nasal hump, you can get something called open roof deformity, where you create essentially a flatness to the nasal bridge. So in order to recreate some three-dimensionality and that more pyramid type of structure to our nose, what helps is to do these osteotomies so that you bring the bones back together. In 2001, at the age of 31, I'm seeing full tooth show on Smile. In 2002, at the age of 32, what I see here is upper tooth show on Repose. So when Melania just parts her lips, we can see the upper teeth quite visibly. And her philtrum, or the distance between the base of the nose and the tip of the Cupid's bow, is now longer than it was in her teenage years. Now, this could in part be due to the aging process. As we get older, our skin expands and lengthens, and because of that, the philtrum can appear longer. But also, people who've had a rhinoplasty can sometimes see that the philtrum gets longer as well. And this is because some of the fibers of the orbicularis muscle that encircles our lips actually interdigitates or connects to the base of the nose. So anytime the base of the nose, or for example the tip, is manipulated in surgery, some of those fibers can be released, and that leads to the potential philtral elongation. And many patients come to me looking to shorten the length of their philtrum with a lip lift. In 2003, at the age of 33, I wanted to say here that Melania has beautiful skin. And some of that, of course, has to do with sun protection and just natural genetics. But Part of it, of course, has to do with skincare and how we properly moisturize our skin and care for our skin. Please make sure to check out our high-quality skincare and hair care products that are available at affordable prices. We built these up from scratch with incredible chemists and manufacturers, and we want you all to try them. In 2004, at the age of 34, what I'm noticing here is that Melania's cheeks look more full, and I wonder if perhaps she's had cheek implants, because there's so much regularity to both of the cheeks now, and there's more projection, that I think it would have been hard to get to this state with filler alone. So perhaps she had cheek implants inserted to augment her already full cheekbones. Alternatively, some people get HA filler placed into the cheeks, and some people get fat transfer performed to the cheeks to further enhance that zone. In 2005, at the age of 35, I see no change, and that's the same through 2006. In 2007, at the age of 37, Melania's eyes here start to appear smaller, and this has become a more characteristic trait of her face. Now, this can be due to a number of reasons, and I speculate on a few of them in this video, but the first possibility is that she may have had a canthoplasty or a lateral brow lift that would have brought out the sides of her eyes, and some people call this a cat eye type of look. Other people call it having the eyes be even more almond shaped, but they all have the effect of lengthening the eye and making the eyes look smaller. I think she also may have started to get some Botox to the forehead, glabella, and crow's feet around this time. In 2008, at the age of 38, we again see that the eyes appear smaller. So other than the canthoplasty brow lift theory, it's also possible that the Botox itself may have been causing the eyebrows to weigh more heavily on her eyes, creating that smaller aperture. Remember that the frontalis muscle is the only muscle that actually elevates our eyebrows. So when you heavily inject neurotoxin into that muscle, what happens is it gets more paralyzed, and as that occurs, the brows start to weigh down. And as that happens, then the eyes might start to appear smaller. And it could also be, of course, a combination of these factors that led to a smaller eye appearance. In 2009, at the age of 39, I see no change, and that's the same through 2011. In 2012, at the age of 42, I'm seeing some early signs of jowling. And that's the area right here. We're seeing some fullness developing there as the cheek complex starts to see some of the effects of gravity. It starts to move down and in, and as it does that, you start to get this jowling that forms right around some of the ligament. And as that tissue comes down, you start to lose some of the definition of the lower jaw. But as I talk about in many of my other videos, the strong bony structure to our midface and lower face is going to partially protect us against some of the effects of gravity and some of the sagging that can occur. In 2013, at the age of 43, I see no change. And in 2014, at the age of 44, I'm starting to see that there are more forehead wrinkles and the eyes are appearing more open. So maybe the dose of her Botox was lowered to combat some of those changes that were occurring around her eyes, with the eyebrows starting to feel a bit heavy. And as she's regained some of that ability to raise her eyebrows, the eyes also start to look more open. In 2015, at the age of 45, I see no change, and that's the same through 2017. In 2018, at the age of 48, we're starting to see some of that neck skin laxity building and becoming more visible. Sometimes what we see is that platysmal bands can form in the neck, and some people address that with Botox injections to try to weaken that muscle so that the bands are less prominent, and other people look to do surgery where they're basically cutting some of that muscle and then repositioning it and tightening it up. And the platysma or the neck muscles can be addressed in isolation surgically, but it can also be addressed as part of a facelift procedure. In 2019, at the age of 49, what I wanted to point out here is that the lip corners are starting to get a bit downturned in Melania's case, and this is very common as we are in our 40s and start to enter our 50s. And this is because of a combination of both volume depletion that occurs at the commissure itself, but also, of course, the gravitational drop that happens as we all age. Some people combat this with doing DAO muscle Botox injections. Other times, a deep plane facelift procedure might help with lifting that commissure from the inside. And there are also procedures like the grin lift, which look to remove a portion of skin out here by the commissure to lift that area. And the grin lift is specifically a procedure that I'm not a fan of because of the scarring that it leaves in a very visible location. In 2020, at the age of 50, I see no change, and that's the same through 2021. In 2022, at the age of 52, I am seeing that Melania's jawline looks a bit smoother, and the neck to me looks like it doesn't have as much of the redundancy or banding that I was seeing earlier. So perhaps she had a facelift, though it's not completely clear, and we're not really able to see her ears well to evaluate if perhaps the tragus has changed or maybe the earlobe itself has changed because of a facelift. We can't tell because oftentimes her hair falls over the ears. So it's possible that she may have had a facelift, but it's also possible that she may have had a non-surgical procedure, such as a skin tightening, say radiofrequency procedure, that may have given her some of that tightness back without a surgical approach. Some of those radiofrequency devices are quite nice for the early signs of aging and to tighten up some of the areas. The problem is that when you later on consider getting a facelift, the facelift becomes more challenging to perform because of all the scarring that has occurred from the radiofrequency procedure. So the tissue planes are not as well defined, and it slightly increases your risk of, say, nerve injury or even bleeding during surgery because of that past exposure to, say, radiofrequency energy or some other heat energy. In 2023, at the age of 53, I see no change, and that's the same through 2024. The total cost of Melania Trump's potential facial procedures is $203,000. What do you think about Melania Trump's transformation? Are her looks all natural, or has she had a little help from plastic surgery over the years? Let me know what you think in the comments below, and please subscribe to this channel.